appointment. So what I see is that you had a doctor's appointment. Yes, perfect. This is for Sleepy, that's the name. Sleepy with those 2 E's. Yes, Sleepy Kitty with 2 T's and a Y. Perfect. So you've been having some kind of headaches and trouble sleeping. Perfect. So what we're going to do is just check your eyes first, because we need to check those eyes. Yes, I will need 2 lights because you have 2 eyes. So please just look up, please. Look up, 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 look up. Perfect. Now look down, look down, look down, look down, look down, look down. And now look to the center, look to the center. Maybe my nose. Do you like my nose? I know, quite nice. Okay, now look at my finger, look at my finger. Keep looking at my finger. Perfect. Now look at this finger here, look at this finger, look at this finger. Very good. You're really good at this. Okay, so now just follow the purple one, purple one. Just follow the purple one. Okay, very good. Now just the pink one, the pink one. Just follow the pink one. Brilliant. Okay, I'm going to repeat some words in your ears. You need to say them back to me. Okay, so fluffy cat ears. Brilliant. On the other ear, I like butts. Brilliant. Thank you so much. You cannot lie, I imagine. So very good. Now what I'm going to do is I need you to breathe very deeply because I need to hear your lungs. Let's see. Have you been vaping? I imagine those vapes. Okay, so breathing. Brilliant. Okay. Don't talk. I need to hear your heart now. So, there we go. What a rhythm. What a rhythm. I really enjoy it. That's really nice. Very good. Okay, so have you been having trouble sleeping, you say? Okay, any problems with your throat? Is that throat okay? Let me see. Okay, I am touching. Okay, now I'm ready to touch you because before I didn't have my gloves and my mask and I was a bit disgusted, so let's just check. Okay, any pain here? Any pain here? Okay, can you lift your right arm? Brilliant, the other one is left. Very good. Okay, can you wiggle your toes? Brilliant, that's really good. Okay, so what you need is ASMR. Yes, 500 milligrams of Carol ASMR. Okay, can you repeat these words to me? I like big butts. Brilliant. Yes, I get that. And the Carol ASMR, you will be done. Okay, thank you so much. Try not to die soon. Okay, bye now. Okay, you can now open your eyes, and yes, well, that was a very good session. You've been crying, and I don't know if you remember it, but it's normal. That's what hypnosis does. So, do you remember something about a dog or a cat? A dog, yes, very good. It was the dog. So what we know as psychologists is that dogs normally is a subconscious way of saying that you have some problems in your digestive tract. So maybe your stomach is trying to let you know that you need to poo. So okay. So anything happened in your childhood about something about that? Okay, are you traumatized? Okay, something about a dog. You had a dog and you had to eat the dog. Oh, there we go. Childhood trauma. I'm so good. Okay, well, what I want you to do now is you're gonna get your hand inside this. Okay. Ooh, at the same time as me, you have very soft hands. So put it in there. Okay, and now let's touch it. And I want you to say with me, it was not my fault. It was not my fault. Maybe this is why I'm vegan, but it was not my fault. I am free from guilt. Now grab your guilt. Grab it. Grab it. Okay, just grab the guilt. Very good. Grab the guilt and now let it go. Good. Brilliant. Great. I'll see you next Wednesday. That will be £255. Thank you for coming. Bye. Excuse me, you cannot rush hard, so what colors do you like? Okay, that's I'm not really good, but sure. Okay, so you really like faces, yeah, Do you like looking like that, or would you like some change? Okay, I think that you will really look amazing with some purple. Have you tried purple? You never tried purple? Well, maybe you should try purple, because if you think about it, purple is the best moment of the day, you know, when the sun is slowing down and you feel like you're gonna die, but then you don't die. You never have that feeling with the sky falling. You never notice it. Well, I normally take my medication at 6 p.m, so that's how we feel. So what we need to do now is to really live in your inner monsters go, so we can see them here in the paper. Okay, it was this a birthday present, yeah, and they told you that I'm really good. Well, I mean, I'm really good at what I do, so I'm really grateful that you came here today, but you talk way too much, so I would recommend you to stop talking so much so your soul can talk, you know what I mean? Because this is how an artist can truly see who you are inside and really add those layers to the painting. Okay, well, I'm gonna show you now the painting. That will be $44. Thank you. You like it? Well, I'm taking it with me. You are insufferable, but I love your face. Call me. Oh, my darling, you dropped your toy, but don't worry. This is your favorite toy. I know, but you need to share it with your classmates, okay? This is for everyone to play. Now, okay, I'm gonna put it here. Just hold it. So I am very proud of you because you've been behaving really well, and I know that Sarah really gets on your nerves. Just hold on to the toy. And I know that Sarah really gets on your nerves. So because your mom is paying so much money for this Montessori school, I made you an award. Yay! So you can take it and she can feel like you're paying enough money for this. Okay, so what I need you to do for tomorrow, my darling, is just to get a piece of paper. Have you ever seen pieces of paper? Have you ever seen pieces of paper? Okay, yeah, brilliant. And then you, for example, you write what you want to do for your holidays. On my holidays, I would like to write letters to my friends. You don't know how to write, okay? Something that we need to work on. It's fine, don't worry. And then maybe I like to draw pictures with my dad. Your dad abandoned you when you were born. Okay, well, whatever you feel like, just do it, okay? So your mom can feel like she's really paying good money for it. And I am so proud that you have not been pulling Sarah's hair today. So please keep doing it. And because of that, I'm gonna give you this Montessori toy. Yes, Montessori is just so you can imagine. They have no face, they have nothing, so you can imagine. You can use your imagination for it, because your phone is really, your mom is allowing you to use the phone and your brain is really fried. So with this, you can imagine what you want it to be. Human bull. No, it's not like human bull. No, it's not. It's a Montessori, but I know I said that you can imagine. What if you just take it? Okay, you arrived for your barbershop appointment. Thank you so much for coming. So you are recovering hair. Like you have lots of hair. Is it supposed to be normal? Because I'm quite concerned about your, because next to the eyes, that's quite weird. That's normal. Okay, brilliant. So we're going to get some jelly. Okay, and then we're gonna put it. Brilliant, just like that. Perfect. And now I'm going to get this and get my fingers full of this. Yes, that's fine. Okay. And on the face. Okay, now we cover all of your face because you have hairs everywhere, especially here. Like your forehead is full of hairs, and your temples and your nose. So you need this cream everywhere. Very good. Look at you. You look. Okay. So like Mrs. Doubtfire, you know, with the cake. So now we have these three. Okay, we have the electrical one, the normal one, or classical one. What do you want? Classical one, perfect. So we're going to just remove all that hair, Oh my goodness, have you been taking some kind of medication that has some kind of secondary effects? Because this is really not very good for you. You know, to be so covered in hair. Your forehead really needs to be so here. So look, what I need to do is just to wet your hair, okay? Okay, because it needs to be wet, because if it's not wet, I cannot cut your hair. Well, I think this is perfume, but well, it's good, so you smell a bit good. Do you like this one? Too much strong? Well, I already used it. So what are we going to do is just cut. Oh wow, you've really been cutting your hair at home, haven't you? This hair makes no sense. No, look at this. Oh, and you've been dyeing it at home. So fried. Ew. Well, don't worry, I'm just doing now like a little fringe. Stop moving your face. I'm going to cut your eyelashes, or even worse, your eye. So now move a fringe. I just kick your ear, but it's fine. You have to. You didn't want a fringe. Well, you have a fringe now, and I really think that goes with your face shape, because your face shape is like very blunt. So this fringe is really going to make you feel like a natural human. Yeah. Okay. I'm leaving. You need to pay when you leave on the comments, but I take a tip. Okay. Bye. So these are the flowers that I was saying that you can use for everything. They're so useful. You can put them on the ark, you can put them on the doors, or on tables, or even around the bridesmaids, you know, like all around them like this. And it's so in this floral decoration, because I mean, do you want real flowers? Because that's minimum £3,000 minimum of flowers. So do you want flowers, or do you want to go to Cancun for a honeymoon? Exactly, my darling, that's what I'm saying. So look at this, looks amazing. Okay, and then look, we have something amazing here, which is this jacket that just came. Look at this, so soft, it looks so sexy. This is for the Hindu, which is the bachelorette, right, for the Americans. So if you want to have this, it's for the girlies or the boys. We're super inclusive, so these are very good, so you can really try it. Look at this. Do you like it? This is from Greece, you know, pink ladies. You have no watch Greece, but you should. They're really good. Let me see the ring again. Oh wow, it's so much bigger than mine. He must love you so much more. Oh, he cheated on you? Well, it's fine, my darling, because you really pay for me, and it was a lot of money, so it's fine. You know, I know this therapy is so good. She even cures all of the childhood traumas with these pearls in a bag. You totally have to go. I'll send you the number. Okay, babes, I'll see you next week. Okay, bye now. Okay, so what I'm seeing with the budget that you told me, I think that the best would be, okay, so Mexican Caribbean, or that you go for a safari in South Africa. But I really recommend the Mexican Caribbean. They are lovely. You need to pay tips, yes, but they're really good. Drinks are amazing, micheladas, margaritas. And then safaris, do you want to die eaten by a lion? Is that what you like, darling? If you want to be eaten out, just ask your partner. Brilliant. So I'm gonna get this for 2, okay, for 3. Oh, you're a throuple. Oh, so modern. Brilliant. So for a throuple, but I cannot get first class for the 3 of you, so you need to choose which one is gonna go in first class with the rich people, and who's gonna have to go with the tourists and with the poor people. So very good. Okay, so you're gonna have some empanadas in the flight and water. Brilliant. And then I have booked you to go to Chichen Itza, okay, Tulum, and cenote, which is like a pool in a cave. It's really cool, really Instagrammable. You'll love it. Brilliant. You want a safari? No, my darling, then you have to go to the Mexican Caribbean. That's where you're gonna go. Okay, that's gonna be 2,000 for the trip. So no, 2,000 for the flights. 2,000, which is my part, and 2,000 well, this can be pounds, euros, it depends. I have to adjust it. Okay, and then it comes with a tote bag. Okay, if you book with us. Brilliant. Thank you so much. Can you save me some chilaquiles? Okay, you'll know when you get there. Okay, bye. Hi, sorry, it's me again. I think I left something on your tooth. Let me just scrape it. Yes, just right there. Okay, just open wide and say, oh. Okay, oh, very good. Okay, can you sing like an ABBA song? Like Mamma Mia, for example. Okay, yeah, I can see the problem. Okay, you've been eating way too many sweets, yes. Well, this is really bad. You need to... Okay, no, I don't have any anesthesia, so this is what you're gonna have to put up with. Okay, but I'm gonna book you with a dentist because I'm a doctor, I'm not a dentist. Obviously, I'm the same one from before, remember? So I really need to really scrape this. Oh, that is so bad. How can you be so bad? So much poo-poo in here. Let me see. Oh, good. And then you have something. Oh, it's going to your ear. Oh, yeah, it was a bag. Well, this is not my expertise, so I'll try to find someone that can help you. Bye. Okay, muy bien. The next phrase, the next trabalenguas, which means tongue twister. Very good, Mandy, very good. Yes. Okay, now relax because it looks like you are on Monday. Is 3 sad tigers, 3 tristes tigres. Okay, 3 tristes tigres comen trigo en un trigal. They eat wheat in a wheat place. you get it? So can you say it with me? Okay, 3 sad tigers eat. Yes, Mandy. Yes, 3. That's what it is. 3 tristes tigres. Can you say it? Well, then you shut. 3 sad tigers. 3 tristes tigres comen trigo en un trigal. Comen means eat. Okay, trigal is the place where the trigo is, where it is stored. Okay. Well, I don't know. I don't store trigo, so I don't know how you say that in English. Okay. Would you like trying to speak 2 languages and pass your A-levels, or do you want to carry on being a B? Zorra. Okay, so no, zorra. It's sorry, class. Zorra, it's the female fox in Spanish, but don't say it to women or men or anyone. Okay, thank you. So 3 sad tigers, 3 tristes tigres comen trigo, wheat, trigo, trigo, T-R-I-G-O, trigo, comen trigo en un trigal, 3 tristes tigres comen trigo en un trigal, 3 tristes tigres comen trigo en un trigal. Okay, well, if Mandy is going to carry on asking and laughing about trigal and how it is actually said in English, we are going to stop saying and learning these fun things about Spanish, and we are going to have a surprise exam, okay, about el pasado pluscuamperfecto in Spanish. Okay, yes, the more perfect past. Yes, well, you thought the past verb forms were very difficult, right? The regular ones. Well, you're going to love this one. Thank you, Mandy. Sit down. Hi, hello. So, I've been told that you had a bug in your ear. Is that it? Okay, don't you worry. We are going to check it right away, but I need to put these things on because I'm a bit disgusted with the bug, so don't worry. I just have some gentle problems with germs and bugs and people. family history. So let me just check here. Yes. Yes, it is this year. I can see because this one looks, I mean, very dirty, but it does not have, no, it does not have any bug inside. No, I cannot see any bug. Okay, I don't see any bug here. Okay, but in this one, yeah, you know what it is? Oh my goodness, yes, there it is. Let me just grab it with this. Let me just. Oh my goodness, yes. There we go. Do you wanna keep it? Well, it was dead.